now I'm asking you that I'm pretty sure that you have treated so many patients from Bangladesh who've been there for IVF treatment. So could you please tell us for our audience that what are the common problem among Bangladeshi patients?
So common problem of the Bangladesh patient can be like irregular period for PCOS, pelvic endometriosis, and also in the male factor like low sperm count, low sperm mortality.
Okay, could you please tell us also those who don't know about what is IVF treatment? So could you please tell us very shortly in easy words what is the meaning of IVF?
IVF is standing for in vitro fertilization, which means we given the woman the hormone to stimulate, multiply egg.
Okay.
And then we bring the egg out of the body. We fertilize with the sperm in the laboratory, resulting to have an embryo. Then we transfer the embryo back to the uterus.
Okay.
So this IVF is offer hope to the patient that's struggling with infertility in case of blocked fallopian tube, pelvic endometriosis, PCOS, or even in the low sperm count or unexplained infertility.
Now my question is globally and including in Bangladesh, infertility problems is increasing day by day. So what is the reason actually behind this, or what is your opinion?
So I think maybe the problem from the infertility, they have a lot of cost. From the most common case is the quality of the egg and the sperm is very bad from our lifestyle, from the PM 2.5, and maybe it cannot explain. But for the medical technique, it can help them to get the children what they want.
Okay, so can you please explain us how do you know that what is the quality of egg is good or bad? How do you know that?
So first, I think you need to have an initial consultation with IVF specialist so we can review your medical history. And for the female, we have to check your hormone, check your ovarian reserve blood test, and also we need to do the ultrasound to check inside that your uterus, your endometrium, and the number of the egg in the ovary to access the female fertility status. Also in the same as male, we will review all the history and we have the sperm check to analyze sperm concentration, sperm mortality, and morphology to access the main status to have a children.
Okay, so can you say that is that genetical problem?
For genetic problem, we also do test embryo for screening the genetic problem and other chromosome abnormality.
So as you IVF specialist, I want to know that as well. Our audience also want to know that what is the success rate of IVF?
Our success rate in my clinic, Bangkok Hospital, the success rate is from 50 to 70% per cycle. In the case of women aged under 35 and the embryo is undergone chromosome check, but for the success rate, it will decrease followed by the age, particularly when the woman age is like more than 40. And it depends on the eggs and sperm quality. Also, it depends on the experience of the doctor and laboratory team. So it's best to consult and find a specialist doctor that have more experience so it can bring you a higher success.
Okay, so is it depends on age?
Mostly the quality of the egg will drop down by the age. It's come down very fast when your age is like more than 35.
Okay. As we know that 35 age is it's called high risk pregnancy.
Yes,
right?
That's right.